obstetrician and gynecologist at Monaco National Referral Hospital. I'm currently a Thrive PhD Fellow at Makerere University. I must say we're beginning on a lighter note because my presentation doesn't have any p-values or confidence intervals. But I would like you to journey with me as we have a case study of a training that we did for healthcare providers for the RCT that we're doing on post-abortion care, and looking at how we are transitioning from the classroom to the implementation at the study site. And that's the presentation outline. As we all know, research is astute and judicious, and it's really one of the requirements that all those that are participating in a study, especially if it's a clinical trial, should be adequately trained. Now, a lot of resources go into this: time, money, human effort, and it's imperative that all those that have been trained actually implement when they are back at the study site. Kahn in 1990 was a researcher that tried to explain what engagement is, and he described this as physical, cognitive, and emotional commitment of one as they're carrying out their roles. Now, we all appreciate that engagement of trainees during study implementation is actually critical, one, to the credibility of the results, but actually also being able to accomplish the study in the required time that we're given. And I'm sure my PhD colleagues are aware of that. This picture just shows us one of the groups that attended the training, and we're saying that evidence, when you look at the evidence, there is little that is written about challenges that researchers face as you're transitioning from the classroom to actually the clinical practice, especially in our context where our resources are quite limited. We have heavy workloads and other challenges that we experience. So what's the objective? In this talk, I'll share with you a description of the level of engagement of trained healthcare providers in the data collection process at the study sites. This is a descriptive cohort study, and the study settings are 8 public health facilities in central Uganda, and these are hospitals and health center falls, and we included healthcare providers that had actually attended the scheduled training. We excluded those that came for the training and were not in the participating study sites. Interestingly, these were 3, so we had to tell them to go back. We purposely selected our sample, and we had a total of 104 participants. So the main outcome is really the level of engagement of our healthcare providers, and we defined level of engagement as someone being actively involved if they had actually managed a study participant within 4 months, within the previous 4 months. Now, in the documentation process, we actually looked at our pre-training sites reports, our training reports, and our study supervision reports, because we do bi-monthly supervision visits, and we as well interviewed the study site's focal person. We collected information on a number of things, and we looked at the proportion of invited healthcare providers that actually attended the training, and for those that didn't, try to get reasons as to why, socio-demographic characteristics, knowledge assessments, and then the challenges that the team experienced. So how did this begin? Of course, after getting the necessary ethical approval, we obtained administrative clearance from the different health facilities, and then proceeded to conduct sensitization talks at the different study sites. And then in this last picture over here, so I don't have a pointer, as a result of the talk, so here we're actually telling them, we wanted to tell them the providers that were actually interested in having to come for the training, and then it was them that selected, the team that selected. So we had a total of 4 trainings, and each 2-day standardized training comprised of 1, an update in the clinical skills on management, post-abortion care, and then the second day was really looking at the study implementation. Because we had quite a big number, we divided this into 4, and the number of participants ranged between 16 to 35 participants. And all these were done at Makerere Medical School in Kampala. 96% of the health providers we had invited for the training actually turned up. Interesting to note, initially we were interested in only doctors and midwives, because those are our 2 study arms. However, when we had the health facilities for the pre-site visits, we were informed that clinical officers may at times be the first point of contact for these patients, especially in the rural facilities. So that's why we included them as part of training to give them the information. Now we see that the midwives, we had more midwives attending, and this compensated for the doctors who didn't turn up. This is just showing us the distribution of healthcare providers by the health facilities. So those are the health facilities. I hope we're able to see. And we can see that in some of the health facilities, like Mukono, for example, we didn't get any doctor coming. And at that point, the team was debating whether we should exclude that site or maybe come up with another solution. And we shall see what we did thereafter. Masaka Hospital is a regional referral hospital, hence it having the highest number of participants. Now, only 50% of the doctors turned up. The reasons, there were too few at the health facilities, so they couldn't leave, or they were too busy with other things. And some actually said, I will not come to Kampala, but if you can come and train me here at the health facility, I'll be able to participate. So for those that didn't attend, we actually proceeded and met them where they were, and we actually took them through what they were supposed to learn. Now, 10 months after the training, 10 months post-training, we followed up and said, of the health providers that we trained, how many of them are still actively engaged in the study implementation? And we, as I mentioned, we said, I already defined what I meant by active engagement in the study implementation, and we only found that 65% of those that we had trained were actually still active. We all know that healthcare provider attrition is a problem in our setting, and at this time we found that 9% of our trained providers had actually left the facilities. 14% of the doctors, the numbers are few, so the percentage tends to be exaggerated, but that's the reality that we had, and 8.2% of our midwives had left. So the transfers to other health facilities were 4 midwives. Now to us, yes, they may be leaving the study, but again, there are skills that they had learned that they can actually implement in the other health facilities where they had gone. And actually they had gone on promotion and they were heading the lower health facilities. 2 participants had actually gone for further studies, 1 doctor and 1 midwife. 2 were terminated, a midwife and a doctor was indicted, unfortunately, and we had 1 midwife passing on. Now, within the health facility, we found that close to 20% of the midwives had been transferred towards where the study implementation could not be done. And so they couldn't participate in the study. Then we asked ourselves, we asked ourselves, is there an effect of knowledge on engagement? So here we compared the pre and post-test knowledge assessment results, and we can clearly see that whether someone was engaged or not, they had a knowledge gain. But in those that were engaged, the knowledge gain was slightly higher compared to those that were not engaged. These are some of the other characteristics that we evaluated as well. And you could see that 71% of the doctors were still actively engaged, which is higher than the midwives. We could see that at the lower health facility, 69.4% of them were still engaged compared to the hospitals because of the transfers from the bigger facilities to the lower facilities. And when we go by the age category, we see that participants who are between 31 to 40 years were actually seemed more likely to be engaged compared to the other participants. So as I come to a close, what are some of the messages that I would like to leave with us? So from this work, and I must say this is still preliminary work, these are preliminary results. What we've been able to get so far is that 2/3 of our trained healthcare providers actually remained engaged in the study 10 months post-training. And we've seen that transfers either within the health facility or outside the health facility actually reduce or affect the levels of engagement. What does that mean as researchers? Is that from the beginning of the study, at the start of the study, we need to plan well in advance and actually train a critical pool of providers such that even when these situations arise that we may not have control over, we still have a number that can remain for study implementation. And then there's also a role of on-job training, especially for cadres that may either be too few or too busy to come for the centralized training. Next steps, we will do further data analysis and then prepare a manuscript for publication. Thank you very much.